Value-based healthcare, or VBHC, is a healthcare delivery model that shifts the focus of healthcare from quantity to quality. Instead of paying providers based on the number of procedures performed, VBHC rewards them for achieving better patient outcomes. The goal is to realign the financial incentives of healthcare providers with that of the patients. Successful application of this model encourages preventative care, reduces complications, and shortens recovery times. By financially rewarding results over simply performing more procedures, VBHC promotes efficiency and improves patient experiences. VBHC isn't a one-size-fits-all system. It's a framework built on several different payment models adaptable to many different situations. One popular model is value-based purchasing, which are a set of performance-based payment strategies that provide financial incentives to healthcare providers for meeting performance benchmarks. If the providers perform well on metrics such as reduced readmission rate or increased efficiency, they will be given a corresponding financial reward. Time-driven activity-based costing tracks costs at each stage of treatment. This has been used to improve the efficiency of common procedures such as carpal tunnel release, allowing for improvements in scheduling to reduce the average length of the procedure to save labor and reduce costs. Bundled payments offer a fixed payment for an entire episode of care. For example, a provider will be paid a set amount for all procedures involved in their patient's heart condition. All treatments, tests, procedures, and so on will be covered by a single payment, encouraging providers to think holistically about how to deliver care and to make their process more efficient. These models aim to align the provider's financial interests with patient recovery, encouraging more cost-effective treatment. They move away from the traditional fee-for-service approach, which pays per procedure regardless of outcome. That older system can unintentionally encourage unnecessary treatments and inflate healthcare costs. In 2025, VBHC remains in the early stages of global adoption. High-income countries, especially the United States, have taken the lead, while progress in low and middle-income countries has been slower, limited by infrastructure, financing, and policy constraints. Implementation is often localized, taking place within individual hospital departments or pilot programs where change is more manageable. National-level efforts, such as the Netherlands Heart Registry, are still rare. Achieving broad system-wide adoption will require significant structural reforms and a cultural shift across healthcare systems. The transition to value-based care faces several challenges, including inadequate funding, weak financial incentives, resistance to change among healthcare professionals, and outdated IT systems. Many institutions still operate under legacy fee-for-service models that are deeply embedded and are difficult to change. Despite these barriers, there are clear facilitators for VBHC adoption. Studies show that VBHC can reduce costs and improve outcomes, particularly through shorter hospital stays and higher patient satisfaction. Patient-reported outcome measures provide valuable insights into care effectiveness from the patient's perspective. Meanwhile, advances in digital health tools, data integration, and performance-based incentives are making it easier for providers to embrace the shift. VBHC is steadily gaining ground, but its global adoption is uneven and gradual. Most progress is concentrated in high-income settings and within specific clinical areas. Operational and cultural barriers continue to slow broader adoption. Nevertheless, the potential is clear: better care, lower costs, and more accountability. The growing use of patient-reported outcome measures and digital infrastructure may accelerate adoption, but the current evidence base remains limited. Studies are often short-term, observational, and region-specific. To fully understand the impact and sustainability of VBHC, we will need broader, longer-term research across diverse healthcare environments. Only then can we unlock its full potential to transform healthcare systems worldwide.